Hi, welcome. I'm Brian Bezic, and this video series is focusing on COPD. I practice in pulmonary medicine just outside of Boise, Idaho for the Terry Riley Health Centers. This video, I want to talk about exacerbations. In many ways, this is one of the most important topics when it comes to treating COPD. The take-home point, I'll give it to you right now. Exacerbations are not bumps in the road. They're not something that the patient goes through and returns to normal. With asthma, that often does happen. Patients get sick and they get better and they return to the way they were before they got sick. That's not the case with COPD. In fact, in one study, patients who had no exacerbations lost 39 milliliters of lung function in 1 year. But adding just one moderate or one severe exacerbation, and that lung volume loss roughly doubled to 76 milliliters of lung tissue loss in 1 year. That's significant. It shows that patients don't go back to baseline. They lose lung function that they never get back. When we think about exacerbations, the causes are most often viral. Viral infections, especially in the winter, can dramatically affect your patient. The other causes might be that they ran out of their inhaler, or they're not actuating or using their inhaler appropriately. Maybe they can't inhale deep enough to get the medication in. Now, the signs and symptoms of an exacerbation, sometimes they're not super clear. Have patients be very aware of how they're doing day to day. Be aware of things like a low-grade fever, body aches, an increased use of their rescue inhalers, more mucus production, especially in the morning. All of these could indicate that an exacerbation is either happening or is about to happen. Encourage patients to reach out to you quickly. Once they recognize that an exacerbation may be happening, if they can reach out to you, you can intervene when appropriate, shortening the duration and intensity of the exacerbation, ultimately limiting that lung loss we just talked about. One last thing about exacerbations I think we forget: smoking cessation. I've had patients, many patients, tell me that it's too late. Quitting smoking now won't make any difference. That's never the case. It's always a good time to quit smoking. But when it comes to exacerbations, I tell patients, if you're currently smoking, when you get sick, you're gonna get sick longer and you're gonna have more problems getting better and much more likely to end up in the hospital. Sometimes that's the trigger to get them to at least think about quitting smoking. The other main point with exacerbations is just the idea that 1 to 2 or 3 exacerbations a year is not okay. If that's the pattern your patient is presenting with, we need to intervene. That pattern will lead to increased lung function loss, increased disability, and much poorer outcomes. When it comes to the prevention of COPD exacerbations, vaccines are your best friend. Vaccines for RSV, pneumonia, influenza, these can change the way the patient responds to these common viruses. Vaccination reduces the risk of getting sick, but its big benefit is the reduction in the risk of severe symptoms, hospitalization, and death. So make sure you're checking in with patients every time. And if there's hesitancy to get vaccines, encourage them, provide them information, and each time they come in, move them a little bit closer to accepting that vaccines are one of the best ways to prevent exacerbations. Also, avoid high-risk situations. Wear a mask in public. Look out when there's viral epidemics going on in your community. I don't want them to stay home all the time, but sometimes it is a good idea to avoid exposure. And again, smoking cessation can help them avoid exacerbations. One additional thing I like to do with my patients is encourage them to make a change. I might say, I'm gonna see you back in 3 months. I want you to come up with something you can do in the next 3 months to improve your breathing. Use motivational interviewing. Get them to suggest something and then document that. Put that in the chart. When they come back, ask them specifically about that change. I can't tell you how many patients have said, the only reason I started going for a walk is because I knew you were gonna ask me about it. Asking them gets them to do these things that they might not otherwise do. So document it, put it in the chart, and ask them, encourage them to make healthy changes. All of that can improve how they deal with exacerbations. The next video, we're gonna talk about escalation of care and those important patient conversations.